Hello, I'm Mark Lupton, the Communications Director for the British Society of Lifestyle Medicine, and thank you for joining us today for an interview with our chairman, Dr. Rob Lawson. So this week, the global lifestyle medicine community is marking Lifestyle Medicine Week. Our annual opportunities to shout from the rooftops the literally life-saving benefits of lifestyle medicine. And so during the week, lifestyle medicine will be in the global spotlight. And it's our chance to tell the world what lifestyle medicine is and why we need it. And hopefully we're going to get some answers to those questions from Rob today. So this year is a particularly special Lifestyle Medicine Week for the British Society of Lifestyle Medicine because 2021 is also our 5th anniversary year. So happy birthday BSLM and happy Lifestyle Medicine Week, and thanks for joining us, Rob.
Well, I'm delighted to be here, still here after 5 years.
It's been a great journey over the last 5 years, and it's been great to be part of it. Yeah, feels like only 5 minutes ago that we were at that first conference in Bristol, Rob. And
Well, yes, I think it was only 5 minutes ago, really. I think thankfully, Mark, you've been with us throughout, and what a great asset you've been as comms director. It's obviously clearly important we communicate our message, and we've got a very good communicator in you. So, yes, it's 5 years has just gone by in a blink. Well, it's not quite 5 years yet, but it will be soon.
And I can't believe it's taken us this long for us to have a recorded discussion like this, Rob, so I'm looking forward to this. Yeah, okay. So as we mark Lifestyle Medicine Week and celebrating 5 years of BSLM, should we kick off with a little bit of a look back and just tell us what it was that originally motivated you to set up the society all those years ago?
Well, can I just put this slightly into context at the start? You know, that this pandemic, this acute infectious diseases pandemic, there isn't any clear end in sight, so it's just there in the background and will be there for quite a while, and that clearly has impacted on lifestyle medicine, and it's clearly impacted on our citizens. There's a New York writer, his name is Adam Grant, who in the New York Times said we've lapsed into a state of languishing, and that to me sums up really what we're facing, that a lot of people are languishing, that they're not flourishing, and I think we've got to somehow as a movement try to move things on to this sort of better state in the future, and so lifestyle medicine has a definitely place to play. However, to get back to the question, the motivation for starting up a society, I think that you'll have to ask my co-founders, I think, as to how they got in. But throughout my medical career, the lifestyle approach really has simply felt intuitively the right way to practice. And it started off, I suppose, with my grandparents, with whom I spent my holidays away from school, and they used to use phrases like prevention's better than cure, and a stitch in time saves 9, which nobody understands these days. But that does seem understandable. I didn't see much evidence of them doing that, but nonetheless, it did seem very logical as a doctor, and I went in really expecting that I would be preventing things rather than treating disease all the time. So it wasn't until I took up practice as a GP that I could see the role, if you like, of lifestyle medicine, and it was specifically because it wasn't on any agenda, it wasn't in any curriculum. That the only area where lifestyle seemed to be acceptable and there was evidence behind was in cardiac rehabilitation, so people with heart problems. It was in its relative infancy then, and we only had one person in the whole of Scotland who was involved in rehabilitation, a consultant, and I got into conversation with her, and then out of that, given that lifestyle issues and so on and so forth are not in the least bit sexy, they weren't then and they still aren't now. Drugs are much better. That she did help me set up a cardiac rehab group in my county.
And so presumably the term lifestyle medicine wasn't necessarily even on your radar at this point.
No, it hadn't been invented at that stage.
Yeah, you might be talking about lifestyle and life, but not lifestyle medicine necessarily.
Correct. That's right. And that cardiac rehab and getting people ready for prehab as well as rehab for surgery, and then afterwards people who have had heart attacks, that was called secondary prevention. And so my role there was in secondary prevention, and my role in primary prevention was in the practice on a one-to-one basis as best I could. But I had to set up a special clinic called the Lifestyle Active Management Program, LAMP for short. But that even that was a bit of a struggle, because my colleagues didn't really see the point. They didn't see that prevention really was anything to do with them. So in terms of practicing lifestyle medicine and the motivation, if you like, to set up BSLM, which is your question, by the end of my career, having retired from NHS, I set up a lifestyle medicine clinic with a view to testing my desire to provide primary and secondary prevention and the principles of lifestyle medicine. And it worked beautifully, but I'm not a businessman, so it clearly wasn't going to work as a business outside the NHS. So I was thinking, well, how do I make it work in the NHS? It has to work in the NHS. We've got this tidal wave of disease hitting us, and how do we... So my friendship with Gary Egger in Australia was really, I suppose, was a turning point. He's one of the founding fathers of lifestyle medicine, and just chatting to him, I thought, well, let's give it a go. The thing to do is to reach into the NHS, and the vehicle must be through a society like this. And so that was back in 2015, I think I had that conversation. 2016, I took the first steps. And lo and behold, I happened to come across Lawson and Michael. So and together we decided, well, let's go for it. So we just went for it, and that's where we are.
Great. So do you recall when you first came upon the term lifestyle medicine, though, and when was there a bit of a light bulb moment there where it kind of seemed to bring together for you some of the things you'd already been trying to do in practice?
Yes, there was. It was reading an editorial from Fiona Godley in the British Medical Journal, which I haven't actually been able to dig out since, but in it she was critiquing some books, textbooks in particular, and one was called Lifestyle Medicine, the one written by Gary Egger, his first edition. And she very bravely said, every doctor should read this. This is what we should be doing. And I did, and realised then that this is now what it's called. It's called lifestyle medicine, and that's where I cottoned onto it. I wasn't aware at that time that the Americans had also set out on the same trajectory. I think Gary at one end in Australia and the Americans in the other, Jim Rippey, had come up with the term independently. So it was more of the Australian line I was going down. So that was my first exposure to lifestyle medicine as a name.
So 5 years on from the setting up of BSLM, Rob, what do you think have been some of the key sort of highlights and achievements that we've seen over those first half a decade?
Well, I think the delightfully enthusiastic, inspirational members. I think that I think it's been great to see how the membership has grown and the people that have joined in. I think that from lots of different disciplines. I mean, they're getting involved in the special interest groups, for example. The regional directors are great around the country. We've got BSLM Cornwall, we've got BSLM Yorkshire, and everything in between, and of course BSLM Scotland. And it's this, when I say horizontal, I don't mean that they're laid back. I mean that the whole structure of the society, I always wanted it to be a horizontal rather than a vertical top down or whatever. So I think that getting them involved and seeing what they're willing to do has been great. So that's something that we want to see develop. The certification in lifestyle medicine is a big thing. That provides that sort of standard, if you like, that people can work to. It begins to chip away at this sense that lifestyle medicine is somehow an alternative approach rather than mainstream. So I think that that's a very important success. We've had, 440 people through already. We've already got over 160, I think, for this year. So that's a significant body of people now who are going out there and practicing lifestyle medicine. The annual conferences have been great fun. It's hard work, as you know, but the first one in Bristol, and I don't know why we chose Bristol, but anyway, it was Bristol. And then we had Edinburgh, Cardiff. London didn't happen, it was a virtual conference. And then, of course, this year, back in Edinburgh for the 5th year, will be a hybrid event, and we're thinking it will be physical, because it's about time we got together again. Then I suppose the team is in place. We have a great, resilient team, you included, and it's it's part of the growth. We've now got an established office and headquarters, so that's another great highlight for me. I think being part of the story of the development of what I started out as shared medical appointments, which are now called group consultations in the UK, I think that's fantastic. I think that the transformation, if you like, in thinking from this one-to-one model to the group model is great, and to be part of that and to be leading on it in some ways is a great plus for BSLM.
And I think to see the move to virtual group consultations during the pandemic has been another great example of lifestyle medicine's ability to sort of innovate as well, isn't it, really, and change adapt to changing circumstances.
Absolutely right. I think that it has to. And I think in fact the whole way in which we deliver healthcare is being challenged because of the pandemic. Not necessarily in a good way, I have to say, but hopefully the good and bad will be obvious quite soon, and we can hold on to the good from before and after, so that we don't start losing people from the profession, because the change is too quick and sudden and permanent, then people begin to say, this isn't what I signed up for. So we've got to be careful. Another plus, I think, is the development of learning. I think the Learning Academy development and our investment in that is very important. And I think that again, in a relatively short space of time, we've got this ambition, and it seems to be working, which is good. So increasing links with academia, very important as well. And so we have a number of universities now around the UK with whom we're working, and again, this is to make sure that our foundations are firm and mainstream. We can't, we're not anything other than mainstream, and it's important to get into that space, if you like. Then international involvement. I think that we are building a lifestyle medicine movement globally, and to be involved with that has been it's been challenging, but it's also hugely optimistic. Then the hashtag One Change campaign is one that is just there. It sits there, and every now and then we give it a kick, but it's a very important one, and one that will have greater coverage probably throughout the world if things go the way we want them to go. And finally,
any recent hashtag one changes you want to share with us, Rob, that you've taken up?
Well, as of yesterday, one of the things that troubles me is the amount of time we're all spending in front of a screen. We know that screen time isn't good for us.
Do you want to finish the interview now? You already know.
Well, I might have to stand up and throw myself around, but maybe I shouldn't. I'll put people off. But I think that there's a 4-minute workout which I discovered yesterday. Actually, is part of our resources for our diplomates. I just suddenly picked that out and thought, well, I'll give it a go. And actually, it's very sensible. And so, yeah, I think that every hour or so, my intention, well, maybe not every hour, but certainly 3 or 4 times a day, my intention is to stand up and go through a set of exercises. That's the latest one, but that's the thing.
You'll have to share that with us, Rob. Yeah, you'll have to share that with us, Rob, and we can share that more widely, because I think and what I think one of the hidden elements of the pandemic has been we've possibly been more at risk of being even more sedentary, haven't we? sitting on Zoom meetings, working from home, so we're not even walking to the station to do the commute or cycling to work. So yeah, great risks of the sedentary lifestyle in the last 12 months. So yeah, make sure you share that workout with us, and we'll push that out to people. But so you did have one more highlight I cut in.
No, well, that was just simply BSLM being noticed. I think that and the sort of aligned organisations that we have now. I think that's hugely important just to get the spread, and again, that's a very positive development. So overall, yes, I suppose if you look at our scorecard over the last 5 years, it's not too bad.
It's an impressive list of highlights, Rob. It really is. Yeah. I mean, I think the conference that you mentioned, it's just been that steady increase of people we've seen every year on year, growth from that, less than 100 in Bristol to, several hundred it was about 800 by the time we got to Cardiff.
No, I think Cardiff was not. I think we got about 800 for the virtual conference. Was about 800.
Virtual conference is definitely a highlight for me personally. That was we had to be quite fleet of foot, but we pulled that one off last year. Yeah, and it's great to be able to offer the mix this year of both the real world conference. We're hoping as many people as possible will come in person, but there is that option going to be there for people to enjoy the conference virtually if they can't.
Yeah, we've got to keep learning, haven't we?
Yeah. So yeah, I mean, you mentioned the pandemic there, and you answered. We've mentioned it a few times, really. But what do you think has been the impact of COVID-19 on lifestyle medicine? Really, we our focus obviously has been on non-communicable disease, and yet the focus of the world last month has been on a communicable disease pandemic. Yet it's actually, I think, drawn more attention to the risks of non-communicable disease, as in chronic illness, that people have been more at risk from COVID. So what do you think has been the implications for lifestyle medicine of COVID-19?
Yeah, well, I think where does lifestyle medicine fit into the last 12 months, perhaps?
Yeah.
And how does it build resilience for the future? Well, the pandemic has certainly drawn attention to how vulnerable we are as humans, and how fragile our healthcare systems are. That is really so obvious. And both really need to be addressed. And I have a little thing to tell you about here, that at local and national levels, we need consistent and often repeated lifestyle medicine messages to try and get a little bit of behavioural change along the way. Through education, we need an educated workforce, don't we? I think that at the front end, we need to have that. But what I've been looking at, given that change is the thing, whether it's at individual level or community level or national level or global level, the word change, and recently I looked at, slightly, off to the side, at the art of change, but not from the medical necessarily perspective, but the world of marketing. And the marketing takes advantage of us all the time. The whole point of marketing is to change our behaviour, and that's what kind of grabbed my attention. And there's a guy called Antonio Damasio, who's a neuroscientist, and he came up with the phrase, "We're not thinking machines that feel, we're feeling machines that think." And again, that made me think, so, well, what does he mean by that? And essentially what he's saying is that everything we do, a lot of what we do is automatic, and decision making comes from the gut. So we all talk about gut instinct, don't we? And so we make quick decisions, simple decisions about complex matters. And I've heard it said that we make 35,000 decisions every day. So you can imagine that if we had to think about them all, every decision would be mentally exhausted. So I think that's one of the things that struck me about it. And that in our #OneChange campaign, we've used a guy's views called Charles Duhigg. I don't know how to pronounce his name, but it certainly looks like that. But that's behind our #OneChange campaign. And what he said was that habits emerge because the brain is constantly looking for ways to save effort. Again, that struck me as a truism. And 90% of our behaviours are habit. So if we use his habit loop, which we do in the campaign, he calls it cue, routine, and reward. We call it trigger, behavior, and compliment or congratulations. But some of the examples from the marketing world were quite easy, quite amazing. I think that there's a thing called Febreze, which wasn't selling very well, so they changed the package, and it made it sort of a package that people didn't mind having on their desk or sort of in the kitchen or whatever, and that was a cue. That was a cue. Well, that's there. I'll use it. And the other one is Starbucks, and they produced an app, so that essentially, as you were going to your work in the morning, you get on the app, and you'd book your coffee at wherever it is on your journey to work. So you didn't need to walk in and get it. So that was that's an example, if you like, of the trigger. And then there's the Toyota came up with the glass of water app. Have you heard of that one, Mark?
I've not come across that one, no.
No. Well, it's just simply on his phone. They have a glass of water, and the idea is that you stick this up on your windscreen and drive in your Toyota, and without spilling the water. This was this.
So in order to make you drive more carefully and safely. Yeah.
But it saved 10% of fuel as a consequence because people were driving more carefully. So that was the sort of the outcome, if you like, the complement, the positive outcome of using the app. So these are little tricks, if you like, that which is why I rather like our hashtag one change, as you mentioned. These are things that are easy to do and they stick. And if we're going to get things to stick, they have to be easy and small steps. So that's the individual way. That beyond that, our healthcare systems, we need to start valuing health. Simple as that. We have to have the resilience and the capacity to cope with these surges, which are in demand, which are going to go on coming. And I feel very strongly we should be investing in creating health. I really do feel that salutogenesis is something that is a dirty word in some people's mind, and that until we change our view about health and health creation, we'll just go on be firefighting. So
good opportunity, perhaps, Rob, can you give people a reminder of what salutogenesis means for those who haven't come across it?
Well, it's health creation. I mean, it's creating health from every walk of life, through policy right the way down to individual health. As Gary Egger says, regulate, legislate and advocate where you can, educate, motivate and instigate where you can't, and medicate, operate or palliate when all else fails. And I think that he's an epidemiologist, so it's long been seen as unidimensional, only looking at disease. And I think my point is that epidemiology is not all about disease; it's also about health, and we really need to be spending quite a lot of time on that, because ultimately we'll never get to the point of health equity, which is what we're really wanting.
So much of our healthcare systems are just the focus is on treating illness, isn't it, rather than creating health. That's got to be the way forward, isn't it, really? But fascinating that we've got some great insights from the world of marketing there that could possibly show us a way forward. And it sounds like possibly from our friends the neuroscientists might have some potential insight into how the brain, the extent of our decisions that are beyond our conscious awareness is phenomenal, isn't it? I think the neuroscientist David Eagleman, you've possibly come across, I think he's put it in terms of there's so much of our mind goes on under the hood. He refers to that so much of our kind of decision making is there underneath the hood, and we're not just not aware of it. So I think there really is the potential there for lifestyle medicine to tap into some of that, how our brains work.
I think that, absolutely. I think that especially doctors are talking about complex cases, but we tend to be reductionist. We will simplify things in order to get to the decision. We all simplify things, and that's human nature. We couldn't cope otherwise. And so I think that's why we just have to understand how habits form and how we make them stick. That's ultimately at individual level anyway. But clearly, there's much more that needs to be done at a much higher level to enable these decisions to be taken.
Yeah. And so could I just move on to you did touch in some of your early answers, Rob, about obviously what had drawn you personally to the concept of lifestyle medicine and how you brought into the consulting room, but just could you tell us a little bit about what illustrates the impact that you've seen of lifestyle medicine on kind of the patients that you've worked with over the years?
Well, we've had, I think that the impacts have been both positive and negative. I think that working the way we do in a one-to-one, I started off with 5-minute medicine, you're not getting much opportunity really to engage with patients in the way that they need to be engaged. So that's why I had to form the charity outside of my practice, really to reach people in a different way, in groups, and to cover what are now called the pillars of lifestyle medicine. However, it is possible with lengthening consulting times. This is just medicine I'm talking about, but other healthcare professionals obviously will have much more time and are getting involved and devoting more time to the lifestyle medicine pillars. It is possible within 3 minutes, a brief intervention to start the conversation, if you like, or to engage with a person who has that light bulb moment. Essentially, you've got to judge when people have reached that point of being motivated and have capacity to change. Otherwise, you're not going to get anywhere. So someone has to start that conversation. And I think really that the primary care doctors, secondary care doctors, anyone in healthcare can start that conversation.
Yeah, let's not forget nurses as well.
It's absolutely, exactly. But they've then got to know what to do with that information.
Yeah.
So that's the most important thing, I think, is now at a personal level, the way my own consulting has developed, because I've been out with NHS and I've got time, I can devote myself to goal setting in a way that I couldn't before, because clearly, again, that's rather key. People have to have goals to aim for, and they have to be realistic, they have to be smart, and that takes a little time. You can do it in general practice with serial visits, and people are, and this is wonderful. It can work even better in a group setting with the group consultation. So those are the impacts are in some cases really quick, and you think, wow, that's fantastic what they've done. But equally, there are people who will push back and say, look, no, I don't want to change. I'm not going to give up smoking. I know it harms me, but so what?
So what do you do in those circumstances? What do you do in those circumstances, Rob?
No, all you can do is advocate at that point. Just reflect back, what the health implications are. That's it. You can't do anything more at that stage.
Can't make people.
But there will come a point where they may want to, and we've got to be able to take advantage of that.
Yeah. So is there any particular sort of standout moment for you in terms of a patient? I'm obviously not naming anybody, but is there any particular anecdote that springs to mind from a patient over the years where you've really felt, this works, and it has worked for this person, and it's just it's been transformational for them?
Well, I think a lot come to mind, but one, let me just say, a middle-aged lady who had been housebound for years, and decided she'd make contact with me, and that the fact that she had been housebound for so many years and made contact, that itself spoke volumes to me about her motivation. Clearly something had made her decide that she didn't want to be housebound anymore, for her very specific medical condition, that she couldn't go out. She had a urinary problem, and she felt that every time she went out, all she was doing was looking for the next toilet. And as a consequence, she didn't go to shops, she didn't go out for meals, she had a holiday for years. And that, I think the end result with her was that she did all of these things, and was absolutely fine, once we had provided all the necessary interventions to make it possible. So I mean that is a huge change. Another one which I often quote, of course, is my friend Neil, who was pretty much written off with cancer, neuroendocrine tumor, given weeks to live, and we kind of got together and formulated a plan, and you're 10 years on, he's hale and hearty, and there's no sign of cancer anywhere, and he's maintained on all of this time his approach to lifestyle as medicine. And finally, I suppose the examples at a wider level are those attending my charity locally, that some have been coming for 20 years after major heart surgery or heart attacks. So I think that my major regret actually is having all the data but never having been able to do anything with it to show the benefit of simply turning up, having some physical activity, connecting with people, getting that support from other folk, relaxing. All of these things were happening, and here they are still, a lot of them still 20 years on, are hale and hearty, and even in this pandemic, some of them have come out for what we call walker size. So they've come out, walking with us. So, I could, there are lots of examples, but I think the problem is that we have to prove at population level that it really, really does work. And that does mean engaging people that currently aren't engaged.
Yeah, so I think those anecdotes are incredibly powerful, really, and that needs to be part of the narrative. But as you say, we also need to draw those together to build a kind of compelling, data-driven kind of case as well, don't we, across populations. So lots more still to be done. And so you mentioned in there, the importance of individual goals and looking ahead. So for the society, for British Society of Lifestyle Medicine, and you have touched on some already. You mentioned things like the Learning Academy, which are in their early stages at the moment. So what can we look forward to over the next 5 years for the British Society of Lifestyle Medicine?
The next 5 years, you meaning the society? Gosh,
yeah, and perhaps lifestyle medicine generally. Yeah. Oh, sorry. I think let's come to that separately. So yeah, let's talk about the society, and then perhaps let's look into the crystal ball in terms of lifestyle medicine and how we can build on the progress we've made in the last 5 years.
Yeah, I think that it's very difficult. I always have the benefit of hindsight. I think looking forward has been difficult. I could not have predicted where we are now 5 years ago. I can say what my hopes are. My hopes are that the society clearly grows in membership and consolidates as an organisation. It becomes a sort of go-to place for lifestyle medicine, education, for example, learning and community. We have to deliver on our charitable aims, and not just to healthcare professionals, but to the public. So that support, educate and advocate, if you like, is an important element of what we must do in the future. So that sort of vibrant community of members and inspirational learning, teaching through our Learning Academy, through whatever innovative ways we can think. These are all aspirations that I hope in 5 years' time we'll look back and thinking, well, we've met all of those. It's been great, and we're into every university in the country, and people are coming out, and people are enjoying medicine again, or enjoying their discipline in a way that they couldn't before. They've come out of their silos and enjoying life, breathing fresh air. So I suppose that would be that consolidation and education and advocacy. These are the things.
It's interesting too. You mentioned the public there. How do we think we can, as a society, we can try to engage the public more? Can you tell us anything about that?
Well, I know that there are plans, and I don't want to prejudge them. But it's a local example. My local charity is doing exactly that. By being there to provide 17 classes in exercise, gentle activity and connectivity and support and learning. We have to do more of it. At the front line. So essentially, we do as a charity have to recognise that it's a different area, and it's not just a question of education. You have to practically get in there and deliver something. So I think if we can perhaps join forces with others, who are doing something similar around the country, become a sort of network, if you like, of patient offerings. That would be, I would say, that would be one of the things I would be thinking of.
Yeah. Okay. And and lifestyle medicine in general, where are we headed with lifestyle medicine in general beyond the British Society of Lifestyle Medicine? The ambition has always been to make this mainstream, and I think we've made great strides on that in the last 2 years. But how do we continue to make this mainstream so that eventually, perhaps even the term drops away, because it's just how we do healthcare, and just how we do helping people to lead healthy lives.
I think that probably comes under the banner of challenges as well, doesn't it? What are the challenges that we're facing? They're both external and internal, of course, but the biggest external challenge is climate change and its effect on the environment, the health of the planet and its citizens. So, as I was saying earlier, I think the pandemic is teaching us a painful lesson. And then there's food, which is undoubtedly contributing to the obesity era and associated disease. So we need to be rallying around uncontroversial science, and the area that I feel strongly about is the processing of food. We know that processed food to various levels cause metabolic inflammation, which is a driver of all these diseases that we're suffering from, including obesity. So I think that's I do get a bit fed up with people bashing on about macronutrients and the bun fights between various, not faddist is not the right word, but there's good science in all sorts of areas, but to claim one and exclude the other, it doesn't seem right to me. And so, how it's not just the macronutrients; it's what we eat, how much we eat, it's how food is formulated. It's cultural importance and all that. This all needs to be teased through, I think, and sorted, because it is a challenge, I think, in many ways. The internal challenge is to reach all these healthcare professionals I've been talking about, excuse me, and members of the public with the message, and so clear messaging, which is science-led, evidence-informed interventions, and mainstream, as we're saying, not optional add-ons to the whole thing. And the new system of working that we talked about, the group consultations, we've got to come out of our silos. We've got to think differently. So all of these are challenges that we've got to get over with. So it's not just all about education, but health equity is something that really kind of gets to me. I think that it's really been so exposed by this epidemic, and how do we right it? It's a terrible wrong, and how do we right it? And so there's plenty of work to be done, and I think that lifestyle medicine can make a real difference here, because of its approach. It's not a biomedical approach, biopsychosocial approach. It has the capacity to draw in those that have least capacity to change, and or agency to change. So I think it gives us the tools, if you like, to affect those changes and to reach the people that need it most. So I think that in terms of health equity and getting to the points, that getting to people that need it most, lifestyle medicine does have a very significant part to play. In terms of the future of lifestyle medicine generally, quite apart from the global development, I think it's bright. I think that what is so wonderful is the younger generation is embracing it. And what I'm discovering is that people in mid-career perhaps are getting a little bit burned out, or browned out, as I call it. And they're showing an interest. It's reinvigorating them, if you like, in their own discipline. So it's because it's so intuitive and it feels so right that I feel very, very positive indeed that finally, whatever we say about its name, this approach is going to make a difference, the difference that we all want it to make.
Yeah, so a huge amount been achieved already, I think, Rob, and as you said there's lots to look forward to as well, really, isn't there? I think there's lots more to still be done, really. I'm really glad you made that point at the end there about health equity. I think that's just so incredibly important, and I think it's often unfairly, I think lifestyle medicine is sometimes accused of not taking that seriously enough, and I think it really is a core part of the lifestyle medicine message, isn't it? Really, those social determinants of ill health, as well as encouraging and supporting people to make lifestyle changes themselves. And very important, I think, that you mentioned the climate change issue and the environmental health as well. And we hopefully look forward to making a contribution to the discussion this year at the COP26 climate conference, which is taking place, of course, north of the border there in Scotland this year. But it's been wonderful to hear your reflections today, Rob. Thanks so much. It's been great to be part of the story with you over the last 5 years, and I'll very much look forward to the next 5 years, and hopefully realising some of those ambitions you've just talked about. But thanks very much for your time, Rob. I really appreciate it, and enjoy the rest of Lifestyle Medicine Week.
Well, thank you very much, Mark. And excuse me, we will be marking Lifestyle Medicine Week globally as well. So hopefully through the hashtag One Change campaign, our hope is that the World Lifestyle Medicine Council will come in behind 3 themes, and we hope that these will be published in the next few months. Okay, we look forward to that with bated breath. And yes, everybody, look out on all our social media channels for some great content this week during Lifestyle Medicine Week, which we'll be sharing with you. Thanks. Bye. Thank you, Mark.